All I can say is that their son, because it was a man, and he's in his 40s, he's in a happier place than we're at right now. Even though I'm getting a second chance, he's in heaven. He's in the best place you can be.
I chose Transplant because it gives me the opportunity to witness people get a second chance in life. And it's a privilege and it's very rewarding.
Hey Jasmine, is there any way you can disconnect the line for me for 421?
Are you able to eat? Hey Agnes, can you waste with me in the med room, please?
Oh, yeah, in the med room. Okay, I'll be back in a minute.
All right, I have your Dilaudid, sir. You think you can take your oral pills right now? Yeah? Okay.
Your phone call from D4W.
Good morning, this is Jasmine.
Jess,
Yes.
did you order the heavy drainage pack?
Yes, I did. It's gonna be for 7. Mornings are pretty busy for us. The bulk of their meds are given in the morning, so there's always rushing. Patients have multitude of medication, especially in the morning. I work in the day shift, and the bulk of their medications are really the ones given between 8 to 10 a.m. It can vary between 5 pills to up to 40 to 50 pills. So Mr. Rundle is my double lung transplant. He just had it's actually his second lung transplant. He had his first in 2010. So right now, the goal for him is to eat. He had his first meal last night, like he was actually advanced to a real food diet, which is exciting for them since they usually don't eat for a couple of months, or even sometimes it may extend to a year, because lung transplant are prone for aspiration. So he still has the tube feeding. It's running at goal rate, so he's tolerating it fine, but we're just working on his nutrition now that he's starting to chew food, and I'm just here to make sure that he swallows his medicine fine. So he has a lot of medications. Tell me your name and date of birth.
Alan Wendell.
I'll scan everything and I'll go through it with you, okay? B1. So you get vitamin B1, and then I have your vitamin D3, so you get 2 of those. You have multiple vitamins, sir. I have your magnesium. Mr. Rundle's doing better. He was able to swallow all of his pills. That was a total of 18 pills this morning. We're just managing his pain right now, giving him pain medicine to prepare him to walk with physical therapy.
Yes, when I'm walking hallway.
It helps? Okay. So we need a gown for the back, we need a mask.
I've got a mask on my table.
So watch. It's clear. You want it clear and over.
Okay.
Yep. Perfect.
So the lights are currently down, usually between 3 o'clock to 5 o'clock. We call it our quiet time. So this allows the patients to get a little bit of break. And if ever it's just a little less stimulation for them, since usually most of their therapies happen in the morning. And also this is kind of the downtime for nurses, just to catch up on charting and other necessity for the patients if ever they need us. I really, really like being part of the transplant journey. I know it's very cliche, like to see their second chance in life, but actually when you see and hear the stories of the patients, it's just very, very, it fills my cup. It makes me go on and on despite how busy the day is.
Well, it's a good thing, but it's a bad thing because somebody had to die for me to get this. And there's a section in the book there on how to write a letter to that persons.
Yes. So you can approach them after your transplant. Your coordinator will explain that to you. So usually they allow the families to
Pretty
greet
generic.
first. It is pretty generic. We want to see you as a visitor, not as a patient,
I hear you.
right?